Assalamualaikum and a very good day to the participant that joined my discussion today. My name is Muhammad Adriazim. Today we are going to discuss about radiographic pathology, which is multiple sclerosis. Now we are going to start with the introduction of the multiple sclerosis. For the introduction, multiple sclerosis is an inflammatory and neurodegenerative disease of the central nervous system. Multiple sclerosis, which is mainly characterized by inflammatory demyelination, is a chronic autoimmune disease of the central nervous system. Multiple sclerosis occurs when the body's immune system mistakenly attacks its own tissues, specifically the myelins, a protective shade that covers nerve fibers. The result will cause an inflammation and demyelination, which is loss of damage of the myelins and which disrupt the normal flow of electrical impulse along the nerve. For your information, demyelination is the immune system targets and damage the myelins, impairing nerve function, and this slowly will block the transmission of signals between the brain and the rest of the body. Lesion and plaques will appear at the damaged myelin in the brains, and spinal cord from scar tissue will appear as a lesion and plaque on the brain scans like MRI. Now we are going to continue with the etiology. For the etiology, as we know, the precise etiology of the multiple sclerosis is not well understood yet. However, multiple sclerosis can be gained and can be caused by a genetic and environmental factors, such as for the genetics plays a role in multiple sclerosis. Family history is one of the stronger risk factors, such as the DR81 gene, the human leukocyte antigen, is particularly associated with multiple sclerosis risk. This gene plays a role in immune system regulation and may influence the body's immune response to environmental factors. Next, for the environmental factors, vitamin D is one of the environmental factors that can cause the multiple sclerosis, which is the low level of vitamin D, particularly in early childhood, are linked to an increased risk of multiple sclerosis. Vitamin D plays a role in immune function and may help protect against the autoimmunity, which is the main cause of the multiple sclerosis. Next. Now we are going to discuss about the sign and symptom of the multiple sclerosis. The first one is a neurological symptom, which is the numbness or tinglings. As we know, it will only happen often in the limbs, face, and other parts of the body. This is one of the more common initial symptoms that we can see when someone has the multiple sclerosis. Next is a coordinates and the balance problem, which is difficulty in walking, unsteady gaits, and loss of coordination, which may lead to falls. And lastly is a vision problems. Vision problems can make the people that have a multiple sclerosis cannot have a good vision, that can cause they to hardly difficult to make a decision about the coordinate. Next is a cognitive and emotional system. Cognitive dysfunction. Cognitive dysfunction is a multiple sclerosis can lead to problems with memory, attention, concentration, and processing information. This sometimes refers to a multiple sclerosis related cognitive dysfunction. Next is a fatigue. Fatigue is an extreme tiredness that doesn't improve with rest. This is one of the common and debilitating symptoms of multiple sclerosis. Next, the sign and the symptom is motor symptoms. First is gait disturbance, which is first is a gait disturbance, and next is a weakness or paralysis that can cause someone that have multiple sclerosis from walk and from do any movement, because the disturbance from the electrolyte to give the pulse from the brain to give the pulse to the muscles. Next is the autonomic nervous system. Autonomic nervous system, for the heat sensitivity, people with multiple sclerosis may experience a temporary worsening of symptoms when exposed to heat, known as UTOF phenomena, which is such during exercise or hot shower and sometimes hot weather. Next is a sexual dysfunction, erectile dysfunction in a man, and a reduced libido or vaginal dryness for the woman can due to the nerve damage from the multiple sclerosis. Second last, the speech and swallowing problems, which can cause the disease, which is dysarthria, which is difficulty in articulating words due to weakness of the coordination of the muscle involved in speech. And next one is dysphagia, which is difficulty swallowing, which can lead to choking, aspiration pneumonia, and malnutrition is not managed well. And lastly is sensory system, which is the paresthesia and laminate signs. Okay, next. Now we are going to discuss about the imaging modalities that can be used to diagnose the multiple sclerosis. First one is the computed tomography. Computed tomography is not the best modalities that can be used. Just it can be used such as for a CT brain scan to rule out any neurological symptom such as bleeding and brain tumors, but it cannot be diagnosed, or by CT scan we cannot see that the person got a multiple sclerosis. By using the computed tomography also, we use it as a non-suitable modalities, because we cannot see the multiple sclerosis sign, but just for a tumor and a bleeding, maybe can help by for the patient that have a contraindication to MRI, such as patient that have a pacemaker. But for the CT computed tomography, it can reveal a brain atrophy in multiple sclerosis, but it less sensitive than MRI for detective multiple sclerosis lesion. For the next one is a magnetic resonance imaging, which is the most used and the most suitable machine that can be used. We will use the T2 weighted MRI, which is multiple sclerosis lesion, will appear as hyper-intense, which is bright in the picture, which the areas on the T-wave images, then that is typically for the area of the demyelination. So as we know, the lesion that we see in the T2 images can be seen in a various locations, including the periventricular regions, juxtacortical areas, infrarentorial regions, and spinal cords. Next, other sequence that can be used in the magnetic resonance imaging (MRI) is a contrast enhanced, which we use a gadolinium contrast as allowing for visualization of active inflammation. After injecting the gadolinium, active lesion will appear enhanced bright on the T1 wedge MRI. This helps to distinguish between all the chronic lesions and active ones. So from these two modalities, we can decide that the best modalities is MRI to diagnose the multiple sclerosis. Next. Now we are going to discuss about the complications and clinical implication. There is some of the complication will happen, such as the bladder and bowel dysfunction. As we know, multiple sclerosis is a corrupt of the myelin sheath that cannot deliver the impulse through our system. That can make our bladder inability to fully empty the bladder. And for the bowel, it can cause a constipation for the patient. And from the complication, the implication that will be faced by the patient or the person is a urinary tract infection. Next, we will discuss about the respiratory complication, which is our muscle in respiratory system weakness. This can increase also the risk of respiratory infection. That can cause implication for the patient is a difficulty in breathing, weakness muscles, can increasing risk and pneumonia. Next is for the motor. For the complication is a muscle weakness and spasticity, which is it can cause a progressive muscle weakness, particularly in the legs and arm, and also can occur to the nerve damage. For the spasticity, increase the muscle tone, which is stiffness, and spasm are common, particularly in the legs. This can be painful and impair of movement, requiring treatment such as muscle relaxation and physical therapy. So the implication will cause a fall risk leading to potential fracture. And lastly is a sexual dysfunction, which is the complication is erectile dysfunction in men, and dryness vagina can decrease the libido in the woman. And next is impaired sexual function, affecting the sexual arousal and response. So for the implication in the sexual impact can cause difficulty in relationship and emotional strain. Okay, next. Okay, this is the image that will appear in the sagittal flare. This image showed the lesion radiating from the ventricle known as a dozen fingers. For you can see the cursor show a shape like a finger that found by Dawson, so that it is named as a Dawson finger. Okay, next. This is the image of axial and sagittal T2 in the MRI. We can see the lesion, the demyelination, will cause a bright around the brain. As we see the sagittal one, you can see the spot bright at the images. That's the lesion that produced by corrupts myelins. Okay, next. So for the technical consideration, we can say that the technical consideration that we can use is an MRI imaging sequence that take the T2 wedge MRI is the best protocol of MRI to diagnose about the multiple sclerosis, which is the T2 wedge MRI is sensitive to the white matter. For the multiple sclerosis lesion, also called as a plaques, often occur in the white matter of the brain and the spinal cord. So we didn't need any contrast such as gadolinium that maybe can affect for the allergic for some patient. Next, MRI T2 wedge MRI also can help by detection of active and chronic lesion. And lastly is a T2 wedge MRI can help by monitoring disease, and it can help us to see the progression for the size, either the increasing of the size and a number of lesions over the time. Okay, next. Okay, that's all for the topics that we are just done discuss. For the conclusion that I can tell, the multiple sclerosis is a complex autoimmune disease of the central nervous system that requires a combination of clinical assessment, advanced imaging such as MRI for diagnosis and monitoring. MRI remains the gold standards, which can providing the detailed visualization like we know just now by showing the white matter site in the MRI T2 of demyelinating lesion. Early diagnosis along with a proper imaging technique and management can significantly slow disease progression and improve patient quality of life. Do you have any question?
Is there a cure in multiple sclerosis?
For right now, there is currently not a cure for the multiple sclerosis, but treatments like disease-modifying therapies such as steroids and symptom management with a healthy management life can help to control the disease and have a quality improvement in our life.
How can people with MS live a normal life?
Many people in multiple sclerosis can have a normal life with a proper treatment such as early diagnosis, modifying treatment, support from others can help to manage the symptom and slow the disease from continue with a daily activity. And for the exercise, healthy diet and stress management also key to the maintaining a good of quality of life. Is there any question again?
No, thank you.
Okay, that's all for our presentation. Thank you for joining our presentation. Okay.